I'm sorry, madam. I have bad news. You have advanced cervical cancer. Sounds like a death sentence, right? No woman should have such diagnosis, especially in this time and age when we can prevent cervical cancer. Before I proceed, permit me to quickly introduce myself. I am Dr. Amina. I'm an obstetrician and gynecologist in training. My topic of discussion today is prevention of cervical cancer. Yes, cervical cancer is preventable. We are so lucky that it is the only gynecological cancer that is preventable. Now, the cervix is the mouth of the womb, and it is located high up in the vagina, so it is easily accessible. The cervix is prone to several insults, especially during intercourse. It is prone to trauma, infection, and one of such infections is infection with human papilloma virus, HPV for short. Now, when a woman is infected with this virus and it is gotten through sexual intercourse, the virus can stay for several years. For the lucky ones that have strong immunity, their immune system will clear up this virus maximum within 2 years. For the not so lucky ones, the virus can stay in the cervix for several years, 10, 12, up to 15 years. And all this while, the woman shows no symptoms. It is a silent killer because it is not like other vaginal infections that we know. When a woman has vaginal infection, she starts having discharge, pain. But when a woman is infected with HPV, she shows no symptoms. And after a while, after several years, the virus turns the cervical cells, that's the cells of the cervix, into cancerous cells. And that is when the woman starts having symptoms such as foul-smelling vaginal discharge, bleeding after sexual intercourse. Some can have lower back pain. And unfortunately, by the time a woman starts having the symptoms, most times the cancer is already advanced. HPV is a silent killer. But thank God for technology and the knowledge God has given us. Scientists have been able to know the natural history of this virus, how it starts as an infection and later turns the cervical cells into cancer. So they have devised a very effective screening program or procedure known as the pap smear. Every woman should have a pap smear every 3 years. Once you are 21 years and above and you are sexually active, what I mean by that is once you are having sexual intercourse, you are at risk of contracting this virus and subsequently developing cervical cancer. But the only way to prevent this is to screen yourself. Have a pap smear done every 3 years. The pap smear has tremendous benefits. Once you do the pap smear, it can actually pick the virus at the infectious stage, and at this stage it is curable. In fact, even when a woman has the early stages of the cervical cancer, it is still treatable and curable. Don't let us wait till we die. Our women should stop dying needlessly from totally preventable diseases. Cervical cancer is almost a forgotten issue in the developed world. Please, let us do our pap smear. I know a lot of women do not like opening their vagina for vaginal examinations. Pap smear is a very simple procedure. It is just the way doctors take your vaginal swab for vaginal infections. It is a very effective, simple, safe procedure. You go to the hospital the same day. Within 5 minutes, you have your test done and you go back home. It does not have any side effect. The only side effect is if you don't do it, you can develop cervical cancer. But if you do it, by the special grace of God, you are protected from having cervical cancer. And it is recommended that you do it every three years. Please go for a pap smear today. In my next video, I'm going to talk about the HPV vaccine and other ways of preventing cervical cancer. Let us take responsibility for our own health. Take care of yourselves. Bye.